Hello, this is Dr. from Korea to Spain. Today I will present a case study using recombinant human bone morphogenic protein loaded onto the dentin powder and root dentin block for the repair of the upper alveolar bone. The official name will be AutoBT BMP for dentin powder and root BMP for block. With addition of BMP, dentin powder and dentin block has increased osteoinduction and conduction capacity. Indications were osteitis, chronic non-healed inflammation, alveolar bone lesion that does not heal well after multiple surgery. Unlike conventional materials, which is mixing BMP to carrier material just before the graft, AutoBT BMP of Korea to Spain is an integrated dentin coated with BMP. Consequently, it has the same appearance as the existing powder and block, and it's convenient to use as well. This is the dentin, which has strong endogenous BMP of its own. Please refer to Professor Kim's lecture number 13 and 14. Treat this dentin to expand the dentinal tubule, loosen the collagen fibers to be exposed to the surface, and then BMP can be stored between collagen fibers as well as the enlarged dentinal tubules. Now, the dentin composite has three types of BMP, two exogenous BMP colored in red and green, and one exogenous BMP colored in black, which may play the major role of osteoinduction after the graft. These are the research papers related to get approval from Korea Ministry of Health and Welfare for clinical safety and effectiveness. Especially, it was a great honor that the histological feature of dentin reinforced with BMP was selected as the cover art in the issue of Tissue Engineering on June 2020. Case for today is a subluxated maxillary right central incisor due to trauma around March 2020 this year, and the patient had undergone root canal and crown for the treatment, but after 2 months, on May this year, the patient visited our dental clinic again, suffering from continuous pain and mobility for more than 1 month. If you look at the CBCT at the time of visiting our dental clinic, the fractured labial wall of the socket does not appear to be fused, and in 3D images, the fractured fragment at the occlusal surface of labial marginal bone level appears to cause chronic inflammation and pain as it continues to move. Diagnosis is non-union of socket wall fracture and non-fixated subluxation of tooth. Considerations when establishing treatment plans are: first, if we do extraction, immediate implant placement, and socket preservation simultaneously, it would be most likely to cause inflammation due to movement and resorption of the fractured segment. And when the flap is open, the fracture pieces does not unite as shown in the picture. Can you see the soft tissue perforation from the socket here? Yes, the fractured segment must be removed in that case. Loss of the labial contour is highly expected, which is disadvantageous to the anterior aesthetics. Second option for consideration is conventional implant placement 3 to 6 months after guided bone regeneration, but it was impossible because the patient refused to undergo such a long, time-consuming procedures. So that the tentative treat plan was determined as simultaneous immediate implant and socket preservation and temporary processes through minimal invasive procedures. For consideration of aesthetic regions, flapless implant placement and socket preservations are performed right after the extraction, and to preserve the fractured labial cortical bone plate, a dentin block coated with BMP was used. For socket preservation, dentin powder coated with BMP also was used. Let's see the video that summarizes the surgical procedure. Prepare a block coated with BMP, and after extraction and place the implant, insert the block between the fractured labial plate and the implant to immobilize the fractured segment. The rest of the space was filled with dentin powders. Then place the prosthetic abutment and suture the occlusal surface. A zirconia crown from patient extract tooth was used as provisional processes when it comes to the exposed dentin materials. In other words, the suture was not watertight, likely in the pictures. It will heal like a natural extraction socket healing. Also, please refer to lecture number 7. Let's go over this again. Place the dentin block being moved in and out of socket several times for the purpose of soaking it with the patient's own blood, and then the block becomes flexible, so it's very easy to fit into the socket. This excellent wettability also serves as an additional function to fix the root block, which enhance the bone regeneration capacity. The rest space around the root block and the implants are supplemented with AutoBT BMP. Again, you must make sure that the blood is absorbed and mixed with the dentin powder. After placing the prosthetic abutment, the suture is for approximation, not for the primary closure. In lower right picture, you will find the sound, the gingival texture, and labial contour that are well maintained after placing the prosthesis. A comminuted fracture of the labial cortical plate is shown in left CBCT with symptoms of pain and tooth mobility when visiting our dental clinics. After the operation, the fractured cortical bone plate was slightly pushed to labial side over the root to BMP blocks. After 5 weeks, the labial cortical plate was began to reunion without any inflammation and absorptions. 6 months later, on the far right pictures, the healing and remodeling of the fractured fragment are well progressed. In the 3D images, the non-union bone fragment is visible. On the right, you can see the cortical plate slightly pushed out after grafting the root block and AutoBT BMP. After 5 weeks, the labial cortical segments were well fused, and new bone is being formed around the implant neck area. In the 6 months pictures on the far right, healing and remodeling of the fracture fragment are well progressed to the implant neck area. Then today's messages are the answers to the questions that goes to the reason why the healing was uneventful, with placing prosthetic abutment and crown in the open wound with exposed dentin powder. And the second question is how labial contour and sound gingival texture could be maintained. The answers are closely related to the lecture of socket preservation, number 7 and 11. The answer I'm now answering first, the dentin powder has the same type 1 collagen as oven bone that is initially generated during natural healing in extraction socket. Therefore, when sufficiently mixed with the patient blood, dentin has the effect of accelerating natural healing process in extraction socket. Furthermore, additional BMP on dentin powder and block enhance the whole healing capacities. Second, root BMP block could maintain the volume and shape of labial contour, supporting healing of labial fractured bone segment. Thank you for your kind attention. This has been Dr. An.